Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering pharmacology, super important guys. And what I love about these questions that I chose, they're not only over the meds, they actually go over the disease processes, which is very helpful. So already guys, you know the deal. If you would like to support this channel, please be sure to like and subscribe below, share my videos with any friends or colleagues you know that are in the nursing program or just graduated that just need that little extra help, that needs that push. Okay, guys, so without any further ado, let's get started. So first question, a postoperative client has a prescription for acetaminophen with codeine. What should the nurse recognize as a primary effect of this combination? A, enhanced pain relief. B, minimized side effect. C, prevention of drug tolerance. Or D, increased onset of action. If you're new to my channel, guys, all you have to do is press that pause button if you want to take a minute to think of your answer. And as soon as you're ready, go ahead and press play again. So the correct answer, guy, is A, enhanced pain relief. So, guys, we have acetaminophen, which is Tylenol, all right? It's an analgesic, and now they're combining it with codeine. What happens is it has a synergistic effect. What does synergistic mean? That means when the two meds work together to make it stronger, to have a stronger effect. Enhanced. You see A where it says enhanced pain relief? That means stronger pain relief, more effective pain relief. So that's the correct answer. When providing discharge teaching to a client with asthma, the nurse will warn against the use of which of the following over-the-counter medications? A, cortisone ointments for skin rashes. B, aspirin products for pain relief. C, cough medicine containing guaifenesin. Or D, histamine blockers for gastric distress. And the correct answer, guys, B, aspirin products for pain relief. Why? Aspirin is known to trigger asthma attacks. Yeah. So you have to warn that patient and educate them about that. It triggers asthma attacks, okay? Next question. The nurse practicing in a long-term care facility recognizes that elderly clients are at greater risk for drug toxicity than younger adults because of which of the following physiological changes of advancing age? A, drugs are absorbed more readily from the GI tract. B, elders have less body water and more fat. C, the elderly have more rapid hepatic metabolism. Or D, older people are often malnourished and anemic. And the correct answer is B, elders have less body water and more fat. So let me explain this to you guys, because this is a huge concept. And if you get this not only for pharmacology, but across the board for nursing, you'll get a lot of answers right. So with the elderly population, it's just wear and tear of the body. The longer that you've been alive, things just start to break down and really don't function the way it used to. And two biggies when it comes to the elderly population is kidney function and liver function. Okay. Now remember, the liver, that's what's supposed to metabolize the drugs. That's what's supposed to break it down. Your kidneys, that's what's supposed to excrete that drug, get it out of your body. So think about it. If in the older population, their kidney function tends to be down, their liver function tends to be down. And let me tell you something else. In that answer, you saw they have less water, and it's true. And guess what? The geriatric population, their sense for thirst is severely decreased. So if they don't have somebody there reminding them all the time, don't forget, Mr. Such and Such, drink some water, take a sip, drink some water, drink some water. Many times they're dehydrated because they're not drinking enough, right? So that's 3 reasons why that drug will not only be concentrated in the patient's body, because guess what? Less fluids you have, more concentrated that drug's going to be. Not only that, if the kidney's not breaking down the drug like it's supposed to, and the kidney. I'm sorry, guys. If the liver's not breaking down the drug like it's supposed to, and the kidney's not getting rid of it through the urine, guess what? It's easy for that patient to get a toxic effect because what happens is that drug, it builds up in the body because the patient's not getting rid of it. So in the elderly population, you will see that when they are prescribed drugs, they're usually prescribed a sub-therapeutic level. So let's say the therapeutic level was 40 milligrams for the average person. The doctor might order 20 milligrams. Why? Because they need less of that drug in their body for the reasons that I just explained to you, okay? So that is very important to know. Please don't forget. Next question. In providing care for a client with pain from sickle cell crisis, which one of the following medication orders for pain control should be questioned by the nurse? A, Demerol, B, morphine, C, methadone, or D, codeine? And the correct answer, guys, is Demerol. Demerol, guys, is a metabolite of codeine. It's a metabolite of meperidine, right? Guess what? In these sickle cell patients, that can what's the word I'm looking for? That can trigger a seizure, even if that patient's never had seizures before, even if that patient's not epileptic, okay? So for pain relief for that sickle cell patient, all the other choices, morphine is okay, methadone is okay, codeine is okay, but you are not going to give them Demerol. And the only reason why, like I said, Demerol is a metabolite of meperidine, and meperidine will trigger seizures on that sickle cell patient. The nurse is administering cardizem to a client. Prior to administration, it is important for the nurse to assess which parameter: A, temperature, B, blood pressure, C, vision, or D, bowel sounds. And the correct answer is B, blood pressure. Guys, what is cardizem? A calcium channel blocker. What do calcium channel blockers do? Lower the blood pressure. So you better take that patient's blood pressure before you give them that medication. What if their blood pressure was 90/60? And you didn't take their blood pressure and you gave them that medication and the patient bottomed out? That's your fault because of bad nursing. Anything that's going to lower that patient's blood pressure, take their blood pressure first. Just like anything that is going to increase a patient's pulse, you're going to take their apical pulse first, right? A client with aplastic sickle cell crisis is receiving blood transfusion and begins to complain of feeling hot. Almost immediately, the client begins to wheeze. What is the client's first action? A, stop the blood infusion. B, notify the healthcare provider. C, take and record vital signs. D, send blood samples to the lab. Guys, the correct answer is A. You better stop that infusion. That is the first thing you do. Whenever you guys get a question about a patient getting a blood transfusion, 90% of the time, it's going to be a question about them getting a blood transfusion, but also having a reaction. Let me tell you something. If you even suspect a patient's having a reaction during a blood transfusion, that's how dangerous it is. If you suspect, you turn off the infusion. You shut it off right away. Does it make sense, guys? I want you to think about this. Does it make sense that a patient's having a reaction to a blood transfusion, which can be deadly, guys, okay? It's a medical emergency. This can be deadly. They're having a reaction, and you go call the doctor while that blood is still infusing. Does that make any sense? And I want to show you guys something. Let's look at our other choices. It says notify the doctor, take and record vital signs, and send blood samples to the lab. Let's say you were going to choose to call the doctor. Call the doctor and tell what? You didn't even take no vitals. What you going to tell the doctor besides what you saw? So let me tell you the steps of what you're going to do. Number one, always, you are going to stop the infusion. Stop it. Whatever's offending the patient, you stop it right away. The next thing you do is assess your patient. Let me tell you something. In that question, you know where it said the patient started to wheeze? Why do you think they're wheezing? That sound of wheezing is air trying to get through an obstructed airway, okay? So right after you stop what's offending that patient, you're going to assess them. You're going to get information so that when you do call the doctor and you tell the doctor what's going on, you have information to tell them. Stop the infusion, assess your patient, which includes taking vitals, then call the doctor and get orders. And of course, you're going to send the whole tubing, you're going to send to lab. The whole thing, okay? Next question. A client with atrial fibrillation is receiving digoxin. Which of these assessments is most important for the nurse to perform? A, monitor the blood pressure every 4 hours. B, measure apical pulse prior to administration. C, maintain accurate intake and output. D, maintain and record EKG strip after administration. And the correct answer, guys, is B, measure apical pulse prior to administration. What's digoxin? What does digoxin do? Digoxin is a great med. It's a great med for AFib. It's a great med for CHF because it increases the contractility of the heart. So let's say the heart was only pumping out a little bit of blood because the contraction was like this because there's so much fluid. So it's only pumping out a little bit of blood. What the digoxin does is make it go like this. You see the difference? It increases the contractility of the heart so the heart can push out more blood. Wonderful. But one of the other things that digoxin does is slow down the heart rate. So even though it increases the contractility, which we love because when that contractility is increased, more blood is pushing out. More blood is going to the brain, to the liver, to the kidneys, to your spleen, to your eyeballs, whatever. That's wonderful. But it also decreases the heart rate. So that means before you give that medication, you have to do what? Check the heart rate. You have to take that apical pulse for 1 full minute. And your range is 60 to 100. That's your rate. That's your range for the heartbeat. So if your apical pulse is less than 60, are you going to give that med? Absolutely not. You're going to hold it and call the doctor. You're going to call the doctor and say, hey, I know you ordered the digoxin. I took the pulse and that pulse is 50. Are you sure you want me to give this med? And if that doctor says yes, you tell them to go down and give the med themselves because you're not losing your license. I'm saying that to say this, guys. With the digoxin, it's a wonderful med, but you have to take that apical pulse because it does decrease the heart rate. The nurse is caring for a 10-year-old client who will be placed on heparin therapy. Which assessment is critical for the nurse to make before initiating therapy? A, vital signs. B, weight. C, lung sounds. Or D, skin turgor. And the correct answer, guys, is B. When we're dealing with pediatric patients, those meds that are ordered, they're based on the patient's weight. Okay? And it's weight in kilograms. So we have to take that patient's weight. That is very important. By the way, guys, the test for heparin is PTT. And the test for Coumadin is PTINR. And I'm just mentioning that because I notice you students, you guys have a lot of difficulty remembering that. You mix them up, okay? So if it's heparin, you're checking the PTT, and if it's Coumadin, you're checking the PTINR. The use of atropine for treatment of symptomatic bradycardia is contraindicated for a client with which of the following conditions? A, urinary incontinence. B, glaucoma. C, increased intracranial pressure. Or D, right-sided heart failure. And the correct answer, guys, is B, glaucoma. And here's why, guys. Atropine dilates the pupil, causes pupil dilation, right? So it causes pupil dilation, I want you to follow me, which increases the aqueous humor. What is glaucoma? Glaucoma is basically, I tell my students, this is how I want you to think about it so you can remember, is basically high blood pressure in the eyeball. Okay? So think about it. If a patient has glaucoma, which is high blood pressure in the eyeball, and we know that atropine will cause pupillary dilation, which increases the aqueous humor, which will increase the pressure in the eyeball, why would we give it? So atropine is completely contraindicated in a patient that has glaucoma because it's going to make that glaucoma worse. It might even make that patient go blind. Glaucoma is high pressure in the eyeball. And guess what atropine does? It increases the pressure in the eyeball. So atropine is completely contraindicated in any patient that has what? Glaucoma. The nurse is caring for a client who's receiving Procainamide IV. It is important for the nurse to monitor which of the following parameters? A, urinary output. B, serum potassium levels. C, continuous EKG readings. Or D, neurological signs. Okay, guys, so if you know what procainamide is, this was an easy question. You guys got it right. So, guys, procainamide is a drug that's given to decrease cardiac dysrhythmias, right? It's for the heart. So, obviously, you're going to want to be monitoring those EKGs. You want to be monitoring those readings to see what that heart's doing. Is this drug being effective? Is this drug therapeutic? If it's not, and you see those dysrhythmias continue or increase, you got to do what? Place a call to the doctor. The nurse is teaching a patient how to administer oral iron supplements to a 2-year-old child. Which of the following interventions should be included in the teaching? A, stop the medication if the stools become tarry green. B, give the medication with orange juice and through a straw. C, add the medicine to a bottle of formula. Or D, administer the iron with your child's meal. So the correct answer is B, give the medicine with orange juice and through a straw. So iron, lots of questions I see are given to students about iron. So let me make this clear for you. Lots of things you guys got to know about iron. In order for the iron to be absorbed, it needs ascorbic acid, okay? What do you get? What's ascorbic acid? That's your vitamin C, okay? Your vitamin C. What do you get? Where do you find vitamin C? Orange juice, right? Lemons. So, but the point is, you need that ascorbic acid. You need that vitamin C in order to absorb iron. So that's why when you tell a patient when they're taking the iron to make sure they take it with orange juice to make sure that it's absorbed. A couple things you need to know. So yes, ascorbic acid. It's got to be taken with vitamin C in order for it to be absorbed. 2, the reason you tell them to give it through a straw is because it can stain the teeth. Okay? That's why with a straw. 3, you warn them that it could make their stool a dark green or tarry color. You warn them, otherwise they're going to freak out. They won't know that that dark iron will come out in their stool looking like that. What else is super important about? Oh, another thing you need to know, iron needs to be taken on an empty stomach, like before they eat. So you tell them to give it to the child in the morning with breakfast or right before breakfast. Okay, on an empty stomach. Actually, not with breakfast, right before breakfast. Why? Because you don't want that iron competing with other receptors. So you want it taken on an empty stomach. 5th thing you need to know about iron. If the iron is not taken enterally, is taken parentally, such as an injection, it's given IM. It's given in the muscle, right? That's the fifth thing you need to know. How? If you're giving iron in the muscle, how's it given? Z-track method. Okay? Z-track method. And the reason it's given Z-track method, the Z-track method seals that iron in. Seventh thing you need to know about iron. Sorry, guys. Iron's important. Lots of test questions come up on iron, so I want to make sure you know this information. Seventh thing you need to know about iron, it's very constipating. Very constipating. So you have to teach the patient, drink lots of fluids. Eat lots of foods with fibers like fruit and vegetables, foods that are high in fiber to help you not be constipated because iron is very, very constipating. Okay. Enough on iron. A client with bipolar disorder is taking a lithium. What should the nurse emphasize when teaching about this medication? A, take the medication before meals. B, maintain adequate daily salt intake. C, reduce fluid intake to minimize diuresis. Or D, use antacids to prevent heartburn. Okay, guys, so the correct answer is B, maintain adequate salt intake. Why? Guess what? Hyponatremia can cause lithium toxicity, and hypernatremia can cause subtherapeutic levels of lithium. So whenever patients on lithium, as a nurse, you have to be monitoring their sodium. By the way, normal sodium is 135 to 145. That's your range, 135 to 145. If it's lower than 135, you're putting that patient at risk for lithium toxicity. If it's higher than 145, that patient is getting subtherapeutic levels of lithium, and that lithium may not be as effective as it should be. The nurse is assessing a 7-year-old after several days of treatment for a documented strep throat. Which of the following statements suggests that further teaching is needed? A, sometimes I take my medicine with fruit juice. B, my mother makes me take my medicine right after school. C, sometimes I take the pills in the morning and other times I take them at night. Or D, I'm feeling much better than I did last week. And the correct answer, guys, is C, sometimes I take the pills in the morning and the others at night. Excuse me? First of all, yes, I'm going to have to go in on this one as well. What do we know about the meds for strep throat? If a patient has strep throat, what are they going to get? We know that patient's going to get penicillin, right? We know that. It's strep throat. It's a gram-positive antibiotic. What do we know about antibiotics? What do we teach these patients about antibiotics? They have to take that med as directed. Now, how old is this child? 7 years old. First of all, I'm not going to go back. This is a 7-year-old, so this is a child, right? So we know that in peds, if it's a child, they're taking this med, it's a penicillin, it's an antibiotic. Guess what? They're taking it twice a day, in the morning and in the evening. You have to teach that child and the parents that they must take that med as ordered. Take that med in the morning and in the evening as ordered, or every 12 hours as ordered. When it comes to antibiotics, you cannot play and just take one sometimes and not take it the other time, because what happens is you build a resistance to that medication. So you have to teach the patients, if you are not compliant and if you don't take this medication as ordered, there's a chance that this infection is going to come back and it's going to be worse next time. You have to tell them that. Okay? The nurse is providing education for a client with newly diagnosed tuberculosis. What statement should be included in the information that was given to the client? A, isolate yourself from others until you're finished taking your medication. B, follow up with your primary care provider in 3 months. C, continue to take your medications even when you are feeling fine. D, continue to get yearly TB skin tests. And the correct answer is C, continue to take your medications even when you're feeling fine. So these patients that are taking their meds for TB, those meds they're taking it's an average of 9 to 12 months, depending on the patient, their physical status, and what the doctor has ordered. But that's the average time that they're going to be taking those meds, 9 to 12 months. Couple other things you must know about TB, because I see lots of questions come from TB as well. This is a famous question, and you guys struggle with this. So let me clear this up right now, and I need you to look me in my eyeballs when I say this to you. The only diagnostic confirmatory test for tuberculosis is the sputum culture. You got that? Are you looking at me in my eyeballs? The sputum culture. Not the skin test, not the chest x-ray, the sputum culture. Okay. Let me explain something to you. That skin test, also known as the PPD, that is a screening test. If it's positive, all that does is let you know that further testing is necessary. It's not confirmatory. It does not tell you that this patient has TB. It tells you that this patient has antibodies. Chest x-ray. Chest x-ray is not confirmatory. It is a screening test. It lets you know if further testing is necessary. The only way you can 100% confirm that a patient has tuberculosis is through a sputum smear. They have to actually cough up deep, get that sputum to you, and it gets tested in the lab. Okay? Please, I see so many students get this question wrong, and I just want to make sure you guys don't ever do this again. What's the only way you can confirm TB? Thank you, sputum culture. A 5-year-old's been rushed to the emergency room several hours after acetaminophen poisoning. Which lab result should receive attention by the nurse? A, sed rate, 2, profile 2, 3, bilirubin, or 4, neutrophils. And the answer is C, bilirubin. Why bilirubin, guys? Let's think about this. What does the bilirubin tell us about patient's liver? Guess what? Acetaminophen, which is Tylenol, is hard on the liver. Yeah. So if a patient has a chronic condition where they have to take Tylenol a lot, you have to be checking that patient's liver functions at least every 6 months, okay? So with this patient who had Tylenol poisoning, and we know Tylenol's hard on the liver, we're going to be looking at levels of things that let us know how that liver is doing. Bilirubin, ALT, AST, right? Those are liver enzymes that let us know how the liver's doing. Acetaminophen, which is Tylenol, is very, very, very hard on the liver. A client's receiving dexamethasone therapy. Which should the nurse plan to monitor in this client? A, urine output every 4 hours. B, blood glucose every 12 hours. C, neurological signs every 2 hours. Or D, oxygen saturation every 8 hours. And the correct answer, guys, is B, blood glucose levels every 12 hours. Dexamethasone, what is that? It's a corticosteroid. What do we know about steroids? They increase their blood sugar. So any patient that's on steroids, especially if they're long-term, you better be checking their blood sugar. What else do we know about steroids? They increase the risk of having fractures because they make the bone porous. What else do we know about steroids? They're hard on the stomach. They can cause ulcers, right? And what's the fourth thing we know about steroids? They mask the signs and symptoms of infection. So when a patient's on steroids, you better be taking their temperature often, and you better be looking for signs and symptoms of infection because they mask those signs and symptoms of infection. Oh my gosh, I am over my 30-minute mark, so we're doing this last question. The nurse is teaching a child and the family about the medication Dilantin prescribed for seizure control. Which of the following side effects is most likely to occur? A, vertigo. B, drowsiness. C, gingival hyperplasia. Or D, vomiting. And the correct answer, guys, is C, gingival hyperplasia. You guys need to know that about Dilantin. Patients taking Dilantin, you have to teach them that adverse effect is gingival hyperplasia. So what are you going to teach them? You're going to teach them to use a soft toothbrush, right? With short bristles. You're going to teach them the importance of oral hygiene, right? Make sure they they not only brush your teeth, but they floss well. Okay, that's important teaching for Dilantin. Guys, my time is up. I promise there are more pharmacology questions coming your way because these are great questions. These are questions that I see students get all the time. Of course, it's not this exact question, but the concept is still the same. So guys, thank you for joining me. Again, to support this channel, if you appreciated this video, please don't forget to like and subscribe below. Share my video with anyone you know that's struggling in the nursing program, and I'll see you next time.